Okay, it's 12 o'clock. We're going to go ahead and get started for our session today. Welcome everybody to our early intervention echo session. If you have not taken a minute to do so, please enter your name and contact information into the chat. As you noticed, we are recording today's sessions. We do that for a few purposes. One is for that quality improvement, as well as to maintain that on our YouTube channel and on our Canvas page, so you can always go back and review this information at a separate time. By participating in ECHO, we're hoping that you can really be interactive. So please take a minute and change your name, put your name and discipline or where you're from on your slide so that we can all see who we are dealing with or working with, interacting with. A case narrative is really one of those great ways to gather more information from your colleagues in this network of great professionals that we have. So if you are interested in sharing a case with us, please consider doing that. As we're talking, sometimes we are talking about pretty sensitive matters, situations. So please remember to protect any individual privacy. Don't mention names, first or last, examples, could be an address or an email. If you have any questions, reach out to our amazing hub team. They are all members that have an asterisk before or after their names. They have a great wealth of information too and would be able to help with that. Here's a way to rename your profile. Like I said, it helps us all know who's on the call, who we have out there, and who we can reach out to. Raise your hand if you haven't figured out how to raise your hand. Here are those directions on how to raise your hand, but you can also just unmute or put your information and question in the chat. Bailey and Kurt monitor that chat pretty quickly. Pre-registration. This is our last session for our 2022 network. We are starting pre-registration for our 2023 early ECHO network. So if you would like to join those sessions, please consider pre-registering for that. Again, to thank you for everybody who fills out those surveys. It really is a way that we can keep these sessions free, provides information for us, useful information that we can then take those back to get additional monies, as well as just making sure that we're meeting all of your needs. So those surveys are what gets the credit for attendance. So anytime you fill out a survey, we will send you a certificate for that attendance. Canvas and RedCap are where we store and send out those surveys. So Canvas is the platform that you can go back and gather, see any of the PowerPoints or any of the videos. If you have any questions on accessing our Canvas, reach out to Early ECHO. And then RedCap, I guess, again, is where we store the surveys will come from. So I'm really excited today to introduce Chelsey. She is a pediatric occupational therapist, and she will share a little bit more about herself, but we're just thrilled to have her to come and talk to us about some feeding issues.
Okay. Okay, that worked. You can now see mine. Okay.
Yes.
Yes, so today I was given a pretty broad category of feeding. So we went with transitions to solid foods and all that entails. So see if I can make it go. There we go. A little bit about me. I am a pediatric and neonatal occupational therapist. I have taken trainings in all sorts of feeding from birth through those picky eater ages. I have extra training in primitive reflexes, sensory integration, and majority of my day now is actually in the neonatal intensive care unit, focusing on feedings and that neuroprotection there. I am neonatal touch and massage certified. I'm also a child passenger safety technician, so all things car seats. There's probably more things that I've trained and done, but I really, that birth to 3 population is probably my favorite, but I see it all. I was born and raised in Hallock, Minnesota. So those unfamiliar with Minnesota, it's that tiny red box at the top there. There's not very many people there. I graduated from UND with my master's in OT in May of 2010. And that's when I moved out to North Dakota. I am married, have 2 sons. Lincoln is 3, currently not sleeping, and Isaac is 10 months old. So we're kind of right in the midst of that transitional feeding. So I've done a little experimenting and done things a little bit different with him than I did my first time around too, which has been fun. My topics for today, looking at feeding readiness, some milestones, feeding considerations, high chairs, different ways that we can introduce foods, chewing skills, open cup and straw drinking. I have a slide on some tips to prevent that picky eating, and then just some of my helpful resources for more geared towards parents. If as a professional you're wanting more resources, just reach out to me. I've got, between my coworker and I, a bunch of different courses that we've taken for more OTP or more OT SLP geared, but I'd be happy to share some of those as well. So to start, feeding is a complex interaction of many components. This was taken from one of the courses I went to. And when we really think about it, it involves the environment, not only the mother-child interaction, but really the parent-child interaction or caregiver, feeding techniques, the positioning, the utensils you use, the swallowing, and the mechanisms of that chew, the integrity of their child, everything from the medical, cognitive, developmental, neuromotor comorbidities, the interaction of the swallow variables with the respiratory system, the GI system, nutrition. So something that we do so frequently and almost take for granted is a rather complex process. Flip too many pages. And then some stressful interactions in that mealtime can actually disrupt and play a part later in life, can lead to prolonged feeding problems, or if they already have a pre-existing difficulty, negative associations or any problems in any of those areas can further exacerbate that. So to start, looking at feeding readiness cues, the recommendation as of now is at around 6 months of age. This child should be able to sit with minimal assistance, have some good head and neck control, starting to bring their hands to mouth, toys to the mouth, appear interested in food. They might be reaching or leaning as you're eating. It's a good sign that they're probably ready to start. For both of my sons, they were closer to 7 months old. They were not early, they were not premature. They just preferred breastfeeding, I guess. So with each child, let it be infant driven. Let the child tell you when they're ready versus, oh, they hit 6 months, we need to start this. There is some leeway in there. There's also waiting too long, but we'll get to that. Another thing to consider is if that child was born premature, adjusting for that so that 6-month-old corrected age in a premature baby may actually only be 4 months. So that premature baby might not be eating till 8-9 months, pending how early they were. So something just to consider. The current AAP and CDC recommendations, again, is that 6-month-old and then continuing to breast or bottle feed until 12 months old. Introducing foods before 4 months is not recommended. And I want to say it was this year the AAP just changed their recommendation. It might have been a year ago. At one point, they were giving like 4 to 6 months, and pediatricians were even saying at 4 months you could start solid foods or purees. They've now changed that to 6 months, which I would agree from a developmental standpoint is better. Looking at some feeding, any questions about readiness before I move on to milestones? No? Good. Okay. So some feeding milestones to look for. We want to see those hands to midline about 3 months age. The hands and objects are starting to come to the mouth about 4 months. We'll start to see a raking grasp or all of those fingers coming together about 7 months, with that pincer grasp, the fingertips emerging around 9 months, but maturing a little bit closer to 10 to 11. Spoon feeding, 12 to 15 months, you'll actually see them doing more of the spoon feeding. It's going to be messy with mastery closer to that 24 months. Fork feeding, again, it's going to emerge around that same time, but that mastery of actually being able to stab the food, which is a little bit different than scooping, it's going to take closer to that 2.5 year mark. Cup drinking, we can start that at 6 to 8 months with lots of support. With that mastery, 18 months, depending how early you start it, you can see that a little bit earlier. And then straw drinking, again, you can start that at that 6 to 10 month time range with independence as early as 12 months. Some more milestones, looking at specifically the oral motor milestones. 32 to 34 weeks gestation, so in utero, or if I'm seeing that baby in the NICU, we start to see coordination of a suck and a swallow. Suck happens way earlier in utero, but we start to see suck to swallow around that 32, 34 week. 37 weeks gestation, I start to see coordination of the suck, swallow, breathe, that entire mechanism. So again, that's more in our neonatal intensive care unit. 4 to 6 months, that reflexive sucking starts to become replaced by learned motor patterns. So sometimes I have seen in the clinic that babies are all of a sudden having trouble with that breast or bottle feeding around that age. If they already had difficulties with breast or bottle feeding, we start to see more difficulties at that age because they don't have that learned motor pattern, or maybe they have a poorly learned motor pattern. So something just to keep an eye on, or know that there might be a slight decrease in skill about this age, pending what their prior feeding experiences looked like. More of an FYI, but if we're having significant problems, then they need to get seen, preferably before they start oral solid feedings. Moving on, 7 to 9 months, we start to see emerging tongue lateralization along with vertical jaw movement and lip closure. And we'll talk a little bit more of those things specifically when we get into the chewing section. And then 12 to 14 months, we start to see that active tongue lateralization, that rotary chew. Molars are also starting to come in about that age where they can grind the food a bit better. So the next few slides, we're going to look at some considerations before we start feeding. Just helpful things for parents to know, helpful things for us as professionals, helping those parents to know, but to know the difference between choking and gagging. Some gagging is going to be typical as we're exposing them to new sensory experiences in the oral cavity. But for that parent to know when they're actually choking and when they need to intervene is crucial, especially if they're going with more of a baby-led weaning approach. And there are resources, I'm not going to go into that. There are resources out there within the local community. There should be infant CPR courses that they could take. I know that there's even, I've seen some online education type things. So if that's something parents are not comfortable with, let's help support them and gear them that way. Embrace the mess. and have a plan for cleanup. We want to avoid wiping hands, wiping the face throughout the entire meal. Being present, do not ever leave that child unattended, especially as they're learning new foods. Being aware of high-risk choking foods, so that might be, so that includes those hot dogs or any processed meat that kind of maintains its shape. Whole grapes or cherry tomatoes, nuts, popcorn, not the puff corn, but like the popcorn with kernels, dried fruit. I'm sure there's others I've forgotten, but that kind of rounds out those high risk. And that's just because they're essentially the size of that child's trachea. The next bullet point, actually going back to being present. Another thing I thought of there is we also want to remove devices and be engaging with that baby. We don't want to be staring at our phones. We don't want that child to be staring at a device. They need to be present and engaged throughout that feeding as well. Child needs to be seated in an upright position, especially as we're learning new skills. We don't want to be feeding on the go. We don't want that child to be walking, crawling in a car seat where you're naturally in a recline position. That's not what the car seat's intended for. As they get a little bit older, eating on the go, that's going to be parent discretion, not recommended. But as you get into toddlerhood, you have to do what you feel is needed. Another consideration, wait until that baby is emotionally ready, especially as we're introducing, again, new things. We don't want that baby or a child that's too tired, hungry, overstimulated. You're just not going to get a good positive experience in that moment. We don't ever want to trick the baby into opening their mouth or sneaking food in. We want to go slowly, allow the child to manipulate food, enjoy the process, let them learn what it's like to feel full versus hungry, and just really learning their body cues. Some other things to consider. This is where, based on what resource you look at, you're going to get some different things. A lot of people are still recommending one new food at a time, monitor for 3 days, watching for those allergic reactions. I know the baby-led weaning approach is like you can offer 1 to 3 foods. You don't have to necessarily do just one at a time. However you're doing it, watch for those rashes, congestion, diarrhea, vomiting, anything that shows a possible reaction. There's also still some old information when it comes to allergens. The old way was completely avoiding them. Avoid dairy, eggs, nuts, wheat, fish until they're 1 to 2. New studies are showing that early introduction can help decrease that. I know personally for both my boys, they told me to start introducing dips of peanut butter, just like the oil on their tongue at as young as 4 months. So ultimately, when it comes to allergens, I just refer back to the pediatrician and let them direct how they want that, especially if there's any family history of allergies. The pediatrician may want to approach that differently, but just know that that's something that we need to be watching for. It can take an average of 10 to 12 times tasting of food before the child will consistently accept. So just because they don't like it the first time or they make a funny face, doesn't mean they don't necessarily like it. Continue to offer that flavor. Avoid your big reactions to them not liking it, because they're learning, they're soaking in everything, how you react. And if you're making gross faces to food, that child's gonna think the same thing. Just trying to keep a neutral face, keeping it fun. One more slide on some considerations. And again, this again is gonna, how much to offer and when, gonna vary by family, vary by what source you look at. Ultimately, my thought is just go with what works for the family and go on baby cues. Some babies are super into it and want a little bit more. My kids, until they hit 10, 11 months, once a day, they're more than happy with. So that 6 to 9 month range, our primary goal is just tasting. Again, we still want breast milk or formula to be the main diet at this point, but we're starting to taste. 1 to 2 teaspoons is really all that needs to be offered. You can start with 1 time a day, moving up to 2 times a day is tolerated. 10 to 12 months, now we're starting to kind of build towards that table diet food. 1 to 2 tablespoons of several different foods, looking at 3 meals a day. As you're getting closer to that 12 months, you might be looking at 3 meals a day, plus 2 snacks in there, following more of a toddler meal plan. But again, until they're 12 months or older, that breast milk or formula is still their main food source. Again, I just refer back to the pediatrician, or if they're working with dietary, as far as what calories are needed and how to fully transition over and off of breast milk or formula. No cow's milk until age 1. And then with meals too, we can start offering an open cup, straw cup. The recommendation would be breast milk or water, typically not juice, but then you also don't want to overfill them if they have breast milk and formula as they're trying to do foods. So some good rule of thumb is, especially at 6 to 9 months, looking at a formula or breast milk feeding, going to foods maybe like an hour, hour and a half later. As they kind of move to that 10 to 12 months, letting them have that solid food feeding, and then maybe they might still want to follow up with a formula or breast milk feeding. Do we have any questions there yet?
So there is a question in the chat on introducing foods that are common allergens. What if there's a family history of food allergies or intolerances? Any direction with when or how to introduce these?
I refer back to the pediatrician. Some may say avoid. It's going to be every client directed, I think. For my niece has a dairy allergy, for example, but there's no family history. It was something that just came up. So as soon as that allergen is noted, I'd go back to the pediatrician would be best source on how to handle that.
Another question came up. Can you repeat what you said about the order of solids versus liquids at different ages?
Oh yeah, so that's 6 to 9 months. So it's not necessarily solid versus liquid, but more when to offer that formula or breast milk feeding, which is their main nutrition source. Typically, we want to offer that breast milk or formula feeding at before, with the introduction or the tasting of solids about an hour, hour and a half later. As we're becoming more proficient in feeding around that 10 to 12 month mark, the child may be more interested in that solid feeding first, and then following up maybe right away, maybe a short time later, pending hunger cues with that formula or breast milk feeding. That makes sense. So basically the early stages, you want them to be a little hungry, but not over hungry as they're getting more proficient with foods, using that breast milk formula to kind of top them off, I guess. Good. Any more?
Chelsey, I have a question. This is Rebecca. Somebody had kind of put in the chat that a lot of pediatricians are still telling parents they can start feeding solids at 4 months. And, you know, thinking of our role as an early interventionist going into the family's home, what would you suggest we respond to parents when they say that? Like for myself, I think I would probably be talking to them about some of the motor milestones that I want to be seeing to make sure that they're kind of ready. But what would you suggest?
I would suggest that same thing. I would come back to what skills are that child showing, and to truly be ready. 4 months olds very rarely can sit independently. And if you, here, I bet I can even go backwards. If we come back to here, looking at that good head control of head and neck, sitting with minimal assistance, even being able to sit independently for a short period of time, I would come back to really focusing on that, because if we don't have good core support and that good postural support, it's really hard for the oral motor skills to work. And that's across the board. That's whether we're feeding an infant by bottle or breast or moving on to solid foods. In order to have good oral control, we need good postural control. So if you're going to put this small child in an unsupported chair and to get good control, I just don't see it happening at 4 months. I'd also come back to the AAP recommendations and pulling out the current ones that not introducing foods until closer to 6 months. And yes, ultimately the parent needs to follow whatever they feel is right, but I would just give them the information. Our job at that point is to educate. Yep, your pediatrician may be saying that, and that was the recommendation at one point, but they, again, I'd have to look specifically. It was this year or last year, they've changed that recommendation, and maybe your pediatrician just hasn't updated that yet. And then even coming back to this slide here where, you know, we're just learning hands to mouth. We don't necessarily want to, I guess this one is probably better. We're just learning hands to mouth. That reflex is just disappearing at 4 months from that learned reflexive sucking. They're just not emotionally ready. So I'd come back and point those things out. Ultimately, it's still parent choice. And if we're seeing a safety concern, you know, then I would halt them and explain the oral transit. They're still in a suckle phase, especially if they're going baby-led weaning at 4 months. That's just a huge choke hazard, because at that point, they're still in a suckle stage. They haven't necessarily learned the tongue projection stage, which baby-led weaning kind of relies on. Does that answer the question?
Yes. And then it looks like there was another question about when pediatricians add rice cereal to the bottle to help satiate at 4 months.
Yeah, I have strong feelings about that, but I don't know. Don't know that here's the place for all those feelings. I don't think it's needed. You're just thickening the formula. You're changing their sucking pattern. A lot of pediatricians aren't even recommending rice because of the arsenic in it. It's not needed. That formula and breast milk is ultimately all that they need. And that's going to be a case-by-case basis. That's a tough question. Thanks for asking, but and it's so hard because you don't want to pin them against the pediatrician either, but I would just educate that ultimately all they need is this. Solid foods, which include purees, are recommended at 6 months, is where I'd come back to with that again. Does anything else pop up about that? No? Okay. Yeah, that's such a tough subject. Okay, moving on.
Someone did just comment and asked in response to that, thickening affects suck swallow. I don't know if you can see that.
It's gonna put extra weight on that tongue. If you don't adjust the level of your bottle to get the rice through it, they're gonna have to suck a lot harder, potentially taking less volume. And that's, granted, that's my experience with the younger infants. I can't say I've ever had a 4-month-old that I'm thickening for that, unless it's a swallow issue, you know, then we're thickening. But yes, unless you're accommodating with faster flows, depending on how thick they're getting in, it can alter how that baby needs to feed, potentially making it harder. Anything else?
There was another comment from Erica that said, I've also had families that the doctor recommended it for acid reflux.
Okay, that would be a little bit different. And pending how young, the theory there, because we have sent some babies in the NICU on that, is it's very, very little to give it weight so that it stays down. At that point, I would hope that it's short term and that they could try again without it. And if you're using, so I want to say Infamil AR and Similac Spit Up, they naturally have rice in them to thicken and give that weight to it so that it's not easily coming up. So that would be different. If it's for a medical reason, that's up to the doctor. If they're recommending that strictly so that the baby's satisfied and sleeps, then I'd maybe be questioning and asking parents to do a little more research on that. If that makes sense. Kind of dove into a whole new topic there. Move on to high chairs. Okay. So high chairs, there are a lot there on the market. Ultimately, what parents are asking about it, a lot of times they maybe had already gotten a high chair in a baby shower, and we're just going to try to make modifications to what they had because they bought it before really ever knowing. I'm guilty of that. But ultimately, we want 90 degrees at the hips, knees, and ankles with support under the feet. We don't want that baby to be leaning to either side as we're eating, because that, of course, is going to change how we swallow. If your child's leaning back in the chair, we want to try to get them a little bit more forward. If you think about how we eat, it's not very often we're just like leaned back here eating. You know, we're kind of sit off the back of the chair, leaning forward to eat. Want that tray at about baby's chest height or below so that they can easily come and reach. Consider a chair that's easy to wipe down and clean, because this can be a messy, messy process. Here are a couple examples. That middle one, I believe, is the stroke trip trap chair. I want to say the other one is the AB Beyond. I think the last one is a Kiko. There are a bunch of different ones out there. I know the IKEA one is a popular one I see in a lot of videos, and that one doesn't have a footrest, but get creative, use TheraBand or cardboard, different ways that we can create a footrest for that. If we don't provide a footrest, the baby's going to be crossing ankles, trying to brace on their own. Speaking from experience, because I bought one that the footrest is not even usable at all. Typically, developing babies with a good, strong core can manage. If we have a baby that has any core instabilities or is super young or any delays, you're gonna want something that they can get their feet down. That feet is gonna help ground them, give them support through that hip and core, which again, if we have postural support, we're gonna have better control in that throat and that mouth to be able to move on with feedings. If it's a chair that naturally kind of leans them back a little bit, or they're leaning to a side, but they can sit independently, try adding some towels, blankets, foam, different things, and try to get them in a better position so that we're really supporting and providing a positive feeding experience.
So Chelsey, there was another question in there. Crystal was asking if you could explain how the middle chair works.
So that one, both horizontal panels can actually move up and down. The child sits on that top one, with that bottom one being the footrest. that particular one, I believe you're probably putting up to a table. There's another one similar to that that does have a tray attachment, and maybe that one too, you can get a tray attachment to it. So it will actually look more like the first one. It's very popular. It's also very expensive for a chair that doesn't look like much. That chair can actually transition from where it's up high, where it is, to be suitable for infants, all the way to where it's down low, and now it's essentially a toddler chair. So you're getting an infant chair through booster chair all in one with that sort of one. The first picture is actually a similar one where it's got all those grooves along the side where that top piece and that bottom piece can actually adjust. You can adjust that bottom foot plate to where the child's feet are, so it can accommodate taller children or shorter children. The high chair on the far end, that foot plate is kind of low and kind of narrow, but you can build it up if your kid has a little bit shorter legs. Hope that makes sense. Move on.
There was a comment, I don't know if you saw it, from Rebecca. It's just the trip trap chair seems to be trendy. We used to use it in the school setting for kids with feeding and stability needs because it's adjustable and can be brought right up to a table.
Yes. And the Kikaroo is actually really similar to the trip trap. And I want to say the Kikaroo is the one maybe that I'm thinking of that has the tray attachment on it.
I think you can get a tray for the trip
trap. Can you on the trip trap?
You can now, yeah, because I know this because I have a niece that has one. She has all the trendy things, so yeah.
They're very, very trendy.
Yes, and expensive.
Yes, yes. And if you have a child that needs any sort of lateral support, that's not going to give it. So they need to be sitting fairly independently by the time they get to that sort of chair. Yeah. Okay. Next. Okay, different approaches for introductions to food. There's baby-led weaning, there's your traditional weaning or spoon feeding, and then there's more of, I've heard it called a variety of things: baby-led spoon feeding, responsive feeding. Whichever approach we take, the ultimate goal is that baby learns to eat all textures safely. Ultimately, we can provide education, but the parent gets to choose what method that they feel most comfortable with, and our job is to support them and that child, ultimately support that child. If that child is struggling with one method, maybe we can provide some helpful information or how we can modify or adapt and not stick to necessarily just one very strict approach. I'll talk a little bit more later, but if we're having troubles in any one of these, may need an OT or speech referral, because there may be some other underlying factors. One note I have here too is that research shows infants introduced to solids, or one research article, infants introduced to solids between 6 and 9 months ate more fruit and vegetables than infants introduced to solids after 9 months. So there is kind of a sweet period there where waiting too long beyond 9 months potentially may have some more prone to picky eating. They're just in a cognitively different place by the time they get to that 9-month mark. I have that article if anybody wants to see it. So starting with baby-led weaning. So it was coined by Jill Rapley over in England or the UK, I believe. It's an alternative method of feeding infants, which promotes infant self-feeding from 6 months of age instead of the conventional parent spoon feeding. Key features that infant participates in family meal times, provided whole baby-sized pieces of food are offered. They feed themselves from the beginning of complementary feeding, so around 6 months of age. The infant decides how much and when and how quickly to eat. And their big thing is there's no need for spoons or purees. So if you're following that strict baby-led weaning, no purees, no spoons. Some pros and cons of those methods. Some pros, baby controls what goes in. It's easy prep. You basically, with some modifications, serve whatever the family is eating. The baby gets to sit and eat with the family. They're exposed to a variety of tastes, textures. They're doing all the feeding, so they get that sensory exposure and exploration, fine motor practice, because again, they're not relying on that parent to feed them. Some challenges or cons of baby-led weaning: missing out on purees, could be potential for added sugars, salts, some of the not so good fats, because they're eating whatever you're eating. Could expose the child to excessive gagging. Now, some gagging is going to be natural, but having too much gagging could cause some added stress, negative feeding experience. If they already have reflex could aggravate that even more. It doesn't follow a natural progression of oral motor skills. I've seen different professionals in the OT speech world not support it because of that. I've also seen different OTs and speeches out there that do support it. So it's rather controversial still if you're following the true strict approach. Because they also don't use spoons, you're also going to have some delayed introduction to spoons and utensils, which I guess I didn't put there.
So Chelsey, there was another question in the chat. Just ask, what's bad about missing out on purees?
Purees are a natural texture that we all, even as adults, eat. I'm guarantee most of us probably have applesauce, maybe during the year. Yogurt is a puree, soups. Also, the natural progression of oral motor skills is we're going to learn to swallow before we learn to chew. And we'll see a little bit more of that later on. But if you're following the true approach, you don't offer any of that. And not saying that you don't. Okay, we're just gonna stick to baby-led weaning. I'm getting ahead of myself. So they don't encourage those types of textures. And we all, even as adults, follow all kinds of different textures. So it's not necessarily super bad, but it's also more of a point. They're not doing any. That makes sense. Little bit more about baby-led weaning. They recommend keeping it simple. Start with 1 to 2 foods. Don't put too many foods on the tray at once. That baby can be overwhelmed. Food can go directly on the tray. They're not distracted with plates or utensils or anything there. They recommend cutting the foods into stick-shaped pieces, roughly the width of 2 adult fingers. So fairly wide piece, giving that baby the ability to grasp it easier. As they get older, as far as I can tell, we start making those pieces a little bit thinner because now they're starting to bite off pieces. As far as choking hazard, as that pincer grasp develops, moving more towards small pieces, following the developmental progression of that baby's hand skills. There's all kinds of books about it. There's all kinds of websites about it if you're wanting to follow the true strict baby-led weaning approach, which I'll admit I'm not an expert in. I tried it a little bit with my second son, just because he could care less to suckle off a spoon, preferred that be independent. As a parent, it's terrifying. It's definitely not for everybody. It's not for me. They even if they have no teeth, they get big chunks in there, and yep, just as the experts say, that baby gets that chunk out of there. But made me very nervous personally. But it works for some babies and it works for some families, and I gave it I gave it a try. Okay. Some good first food ideas. And I put this in the baby-led weaning section, but ultimately, at any point that that baby is ready for finger foods, these are all good choices. The banana, avocado, sweet potatoes that are cooked, salmon, broccoli that's steamed. You see that a lot, like with baby-led weaning. A lot of the pictures are they're holding like a tray of broccoli. Meats, I should have thrown the picture in here. I let this little guy just like gnaw on a hunk of, must have been pork chop. It went great. Eggs, yogurt. So they do say yogurt. I don't know what site I got that from, but oats, green beans that are steamed. Okay. I'm sure that there's going to be a ton of questions. I feel like some of it's going to be answered as we move through. So I'm just going to go through baby-led weaning, traditional weaning, and then kind of the combo approach. And then we can kind of talk about all of it, if that makes sense. Because I feel like I already know some of the questions are probably going to come. I feel like they'll be answered later. Okay, so traditional weaning, if you're going that traditional spoon feeding, the baby learns some pros. The baby learns to swallow safely first and learn to chew later when they're developmentally ready. As the parent, you know exactly how much volume that baby has eaten, which is not crucial at those early eating phases, but for some parents, just eases their mind. Can still get a variety of flavors. People think of purees as boring, but especially if you're making your own, there's no reason that you can't be adding spices, seasonings, blending up whatever you have made for that baby to try as well. Some challenges can be time consuming if you're preparing your own purees, can be difficult to feed the infant and yourself if you're having a family style meal. If you're truly doing like the traditional approach where parent is feeding the baby, they're going to have decreased opportunity for that sensory exploration. Potential for feeding baby past that point of fullness. They may not be picking up on all the baby's cues. And then there's always that potential of getting stuck on purees as well, which I think is kind of where baby-led weaning came in, is they didn't want to be stuck on that puree phase. If we are going more of a parent feed by spoon phase, you can see he's helping. Feeders should be down at eye level. We don't want to be standing up against or up above baby. We want, because that's just going to promote him to look up or her to look up as well. So you want to be down at baby's eye level, have a shallow spoon with a level handle. So you don't want a spoon that's kind of big curve to it. You want kind of a straight, flat almost spoon and handle. Offer just a small amount. Child should open their mouth. We don't want to be force feeding them. Place the spoon on the tongue about midway back and provide a little bit of downward pressure. And then move the spoon straight in and out. A lot of what you'll see with parents that go towards this approach is a lot of it comes in and then we're scraping on the gums. We're emptying that spoon for the child versus letting the child close their lips and learn to scrape themselves. So just in and out. And by putting it in and providing a little bit of downward pressure, we're encouraging the tongue to start suckling and then those lips to start closing so that they can do the scraping off of the spoon. Okay, yes, so kind of a hybrid of it all. Baby-led spoon feeding or responsive feeding, respectful food spoon feeding, whatever you want to call it, depends on who you're looking at. Kind of a hybrid approach of baby-led weaning and spoon feeding, which more my preference. Still follows the progression of a puree to a solid, but you're still following the baby-led weaning principles of letting that baby be involved. Fosters positive feeding experiences. Baby directs still how much and how fast. You're offering utensils, so we're still going towards independent utensil use. allowing sensory exploration. Something to note, not every meal needs to be that way. If you're out and about and not ready for the mess, there's flexibility. And then focuses on respectful spoon feeding if you are not going with the baby led for that particular meal. And I have that on the next slide, actually. Yes, so this is my older one, younger. He's clearly done. But some ways that we can be respectful when it comes to baby-led spoon feeding, or if we are feeding them. No sneaking food into the baby's open mouth. We don't want to be restraining the arms. No forcing the food into a closed mouth. No scraping food on the gums. Also, if we're going towards that baby-led spoon feeding, so baby has a spoon, we don't want to be wrestling that spoon back from them. At this point, I'd recommend multiple spoons, which I'm pretty sure I talk about later, but I'll mention it here too. So if you've got even two, you have one, hand it to baby, let them play with it, eat off it. You don't want to be wrestling that spoon back. Now you're just going to make him mad and think that he can't have that. So giving him another one, if he wants to hold on to two, offer a third one. He's going to have to give up one of them to get what he wants. So we want to be respectful of what it is he's holding on to at that time. We don't want, and with all approaches, honestly, these go for all approaches, but we don't want to be obsessively wiping the hands, wiping the face. We want that baby to experience and play with the food from a sensory standpoint, but also from a sensory standpoint, if you're constantly wiping the face, now we're overstimulating that with a rough texture. It almost can create sensory aversions on the other side. It's probably not the most pleasant feeding experience. If you're sitting there eating and mid-bite, somebody comes through and wipes off your face, it's not exactly what we want. You want to save cleaning up for the end. And then you don't really want to use the spoon to be obsessively scraping off the face either. So with this too, some signs of fullness and being respectful, turning away, pushing food away. If the baby starts to get fussy, they're most likely done. If they're distracted, start throwing, dropping food. It's a good sign that baby's full or baby's done with that meal. So respecting their cues and either letting them play or getting them out of there and moving on. Feeding is also a good time when I like to introduce sign language, because a lot of times that early, they can start to communicate with you by sign, but not necessarily by words. My 10-month-old, for example, we are working on more. I think we got it once or twice last night, which is great. But more, eat, all done, drink, are all great starting signs. And food is a great motivator to learn and incorporate some of those signs so the baby can start communicating too versus just becoming fussy.
Chelsey, I'm just going to interrupt you. Yes. You have about 5 minutes.
Okay, well, I'll move a little faster. Will people have access to this? Okay, we'll skip through some of these then. So here's just kind of, let me see. Yeah, we'll continue with spoons. The rest I'll let you kind of read through. Looking at spoon feeding, again, here's kind of your progression of textures. The key with, if you're going purees, is to not get stuck on it. As soon as babies start showing that they're opening consistently or tolerating it, starting to swallow it, move on to the next one. Should only have to be on purees for a couple weeks, maybe a month at max, pending baby's skill. Then move on to some fork mash solids. While you're doing fork mash solids, introduce the silicone feeder if you want. Those are going great. Just keep moving up the ladder as baby shows that they're tolerating that skill so that you're not getting stuck. Moving on. I do have in here some utensil use and recommendations. Short, wide handles are going to be best so that baby's not stabbing themselves in the back of their throat. And yet if it's wide enough, they can hold on to it. I have the little green ones. I don't know anything about the other ones. A lot of people like them. They're very in right now. Here is just a little bit about chewing, how it's a learned skill, that tongue control is critical, and then progressing from munching, vertical chewing to diagonal chewing and rotary chewing. How to begin with some non-food items. Let's see, that kind of explains it all. Here's some open cup suggestions, and that again can start right away. The main thing I'd like you to know with open cup is filling it full enough. If you're only putting a little bit in there, now that baby's got to tip their head all the way back. So filling it full, so we only need a slight tilt is going to be best. These nosy cups, those green ones on top, those can be helpful because they won't have to tip at all. It's going to make room for their nose. You can email me questions. Straw drinking, again, that can start right away as well. One of the main things you'll see a lot with straws is you want it to be short enough in the mouth. You don't want a straw that's this long and in the mouth that's just going to continue to encourage them to suckle on the straw. There's some considerations for the straw. I do have just a brief slide on feeding tubes and how you can include those children into the family meal. Ultimately, what they're eating, how much they're eating, what they're tasting is going to be dependent on their care team. I have a whole slide on preventing picking eating. Some of these things we've already talked about, which is kind of some helpful tips, I guess, things to do to ultimately variety, letting them explore, letting the baby touch, serving different colors, avoiding negative experiences, following baby's leads, not giving them any pressure or bribing. You know, we don't want to be, eat this, you can have this as they get older. As we get to that toddler stage, changing the presentation so it's not always looking the same. All those types of things are just going to continue to expose them to a variety in hopes to prevent some of that picky eating. And of course, if at any stage they're having troubles with any of these skills, they may just need to seek out an OT or a speech therapist that specializes in feeding, because there may be an underlying factor either with sensory systems, oral motor skills, the swallow, that they may be, which you guys all have those people on staff as well. So just pull in that specialist at that point to see if there's something else that can be worked on. I included a few of my favorite Instagram accounts. They're all professionals. They all have a little bit of different approaches too. A lot of them have parent courses that parents can take. I want to say I've signed up for 1 or 2 of them with my first kid. This baby foodie is full of recipes. She breaks down, I guess it's a whole team of people, but they break down foods for either purees all the way through baby-led weaning. They have toddler recipes, how to make foods different colors, mixing foods. I've tried a lot of their recipes. They're actually delicious. She's all about purees don't have to be boring either. You don't just need to blend green beans and let it be. She talks about mint in there or basil in there. Things I never would have thought of until my firstborn. Genius. Feeding Littles, if you're on Instagram, is hilarious. So some good resources there. I also like Solid Starts. They actually have an app, and here's a screenshot of some of the pieces of the app. So it can search foods. They'll show you, oops, too far. Show you exactly recommendations for different ages, how to serve it pureed versus baby-led weaning style. If you buy the app, the parent can actually track what foods they've tried, the reaction to things. New age parents are all about, you know, the social media and the different apps and tracking everything. So if you have that parent that feels they need to track, I found that app to be helpful. Okay, did I make it?
Yes, thank you. That was such a useful information, and it was so needed. We are actually in our 2023 network, and starting in January, our first 4 sessions will be all on feeding. So you've set that stage to help work with us on that. So I appreciate it so much.
Yeah, it clearly was prepared for like an hour and a half by the looks of it.
Well, you were good on it. Gave us some really nice things. I'm gonna ask Shelby to come on, and she's going to be sharing our case presentation today. Shelby, are you there?
Yes, I am.
Okay.
Let me just. Can everyone see that?
No, Chelsey, I think you have to stop sharing and then you should there. Okay.
All right, and slideshow. There we go.
Yep, that's perfect.
Perfect. All right. I don't know, Jessie, do you want to? She knows way more about this little person than I do, so
okay.
she might have way more to say.
We'll do it together.
Okay. Perfect. All right. Well, I'm Shelby. I am a speech language pathologist with the Infant Development Program in Minot.
And I'm Chelsey Reiter, and I'm a BCBA and an interventionist with the program as well.
Oh no. Hold on, wrong one.
Like, I filled it in. She was quizzing.
Jessie, do you have it? Or no?
I don't have it up, but I can get it up. Give me a second.
Because if you guys don't have it up, I also have it. I could share it.
Oh, I've got it here.
Okay.
Okay, Jessie, take it away.
Okay. So this little guy is 2 years and 9 months. He has limited expressive language. So he'll, I started seeing him in March, and he would do kind of just a lot of whining and would just kind of pull mom to what he wanted. And so since then they moved homes, still in town, but they moved home. And so it's very interesting that his communication also changed when they changed home. Before he would do a lot more initiating to try to get mom to guess what he needed or to try to help. And now he'll just he likes answering yes and no questions. But a lot of his behaviors will come when mom doesn't know what he wants. So he'll whine, and then she'll go through a list like, do you want a drink? Do you want water? Do you want milk? Do you want a train? Like, she just runs through a random list. And sometimes he's satisfied with that, and sometimes he isn't. When she hasn't found what it is that he wants, he'll end up having some pretty tough behaviors. It's hard to tell whether it's always a communication-based behavior or if some of it is also, I didn't get what I wanted, so I'm going to have a behavior. When he becomes upset, he'll be aggressive. He will push, hit, scratch, kick towards his parents and his younger brother. And any form of no, or even if it's not right now, we'll do that later. He'll hit himself. He throws himself on the floor. He used to hit his forehead against the floor and near the wall. It's gotten a little better. Now it's like he'll braces himself just a little because he knows it hurts, but he will still do those behaviors. This guy lives with both parents and one younger brother.
He's also started biting, right? You just said he started biting.
Yep. Oh yeah, he started biting. So that was on Monday. Mom let me know that now he's biting. So little brother, biting would be an appropriate thing for that age range. But I think he's learned biting is effective, right? If I bite brother, he drops the toy or moves away from me or whatever it is. But he will bite in front of mom, like doing it when mom is looking. So he's not worried about mom's attention. He just does it because it's effective. Mom has said she's much more of a visual learner and prefers videos of how to do activities so she can watch it when she's got time and rewatch things. He does have a variety of sensory needs. They've got almost like a jungle gym type thing set up. They have a really big backyard. So in North Dakota, it's too cold today to go out, but when the weather is nice, he used to get a lot of sensory input from going outside. They do let him like jump on the chairs and the couch. He's got a little trampoline in the basement that they can use. So they try to make sure that he gets a variety of sensory needs. He does go to daycare once every couple of weeks for that socialization. Mom said he's pretty quiet and doesn't really interact at daycare. She's never gotten a behavior report, except that he will not eat at daycare as well. He does receive direct therapy for speech and OT concerns, and that has been going on since, I want to say like May, June. He's been getting direct services, so it's been a bit. So mom's primary area of concerns are that he does not stay asleep. She typically has a very strict bedtime routine. He goes to bed, give or take 8:30, and he will wake up around 12 a.m. and is up until 3 o'clock. He does not nap, and if he's tired, he'll like try to bring mom to the door because he wants to ride around because he's tired and wants to nap. She can't always take him for a drive so he can take a nap. And so then that becomes a problem. And when he is awake, he also wakes up little brother. And so then everyone is awake in the household from 12 to 3. She said before he would have a pacifier and he ended up breaking it and then didn't want another one. And so when he was awake, he used to just kind of suck that and babble to himself and kind of be content. But since that broke, there's no self-soothing happening. He will only eat lo mein noodles and the snack foods like goldfish, graham crackers, like the corn dog on a stick or not the corn, like the pancake on a stick. He'll eat a few bites of that, but he doesn't eat any meats, vegetables, or fruits. He'll just move them off of his plate, give them to brother. She's tried sticking them in noodles. Mom really likes to cook, so she does it a variety of ways. And so they eat all together. And so she's like, the foods that we try to give him, he's seeing 100 different ways and 100 different times, and he's still just not really interested in trying them. He has about 15 words to communicate. He is not consistently using signs or picture cards. He does have both. He'll sign, if you prompt him, he'll do some of the signs. And we've made picture cards that he used consistently before he moved. Once he moved to this house, like I don't know if it's just too much effort to get them out. We've tried moving them so that they're very easy access for him. And he's still he really lacks in that initiation of trying to communicate. So his behaviors are also a concern, that hitting, kicking, head banging, biting, crying. Some of it may be some emotional dysregulation. She does say that like if he naps, sometimes it makes a difference, sometimes it doesn't. The one day dad kept him because she was like, I thought it was just me, but dad watched them while mom had appointments or whatever. And when she got back, dad was also in tears because it had been a very rough day. So it's not just something happening at home with mom. It also is very tough with dad. So that was one thing to note, that it's not just a one-parent concern. So mom's goals would be for him to sleep through the night. She's like, if I need to bring him to bed earlier so he stays up later and then sleeps longer, you know, whatever that is to get some consistent sleep. She would like him to try one new food a week, to have more than 50 words or signs to communicate. He will say words occasionally, but I think, you know, he's very shy. Like I heard him say don't the other day, but now it's been weeks and I have not heard that from him since. So he'll say something very quiet and you might catch it. Yeah, he does drink from an open cup. He drinks from a straw, from a sippy. Mom doesn't give him a ton of open cups because he's still pretty messy, but he can do it. And they like to reduce his behavior tantrums to less than 10 minutes. So they used to be even longer than that. Behaviors have reduced, but they're still happening pretty frequently. So ever since losing the pacifier, a barrier is that he doesn't have a way to self-soothe. He would rather get food in his belly than to refuse or force him to try new things. So mom just wants him to eat, right? Like whatever you'll eat, eat. He's very shy and not super confident in using words. The SLP at private therapy thinks he might have apraxia. And then mom wonders if because she is a stay-at-home mom and he isn't around other kids as much, that if maybe that's one of those troubles. So they have sort of specific meal times, right? So it's like a general rule of they end up having lunchtime. I want to say it's like between 11 to 12 because the younger one will nap at noon until 2. So it's like a generic kind of rule of thumb for times. And mom will try to make it as fun as possible. She's had them have their own little table. Sometimes they do it all together. She's tried to do like a picnic style to see if that makes a difference, or they do it in the living room and we've got blankets and, you know, whatever kind of way to get them to eat that would be more fun. The kids do some grazing, that, you know, they'll have the plate and if they go play, do whatever, they can go back and take a bite, and which may be some of it, but again, she just wants them to eat something. So she doesn't take it away from them once mealtime is done. Let's see some of the other questions. She has not brought him to a pediatrician that I know of for any GI issues. She's never mentioned anything like that. So I can't say they've been ruled out, but she's never made a comment about that. Or two. Let's see. So they've tried using a weighted blanket and it worked and helped for a while. And now he'll use it to calm himself down when he's really upset, but he doesn't help him stay asleep. They've removed all of the toys in his bedroom. He now only has a nightlight and a sound machine. He currently will prefer to go and lay to sleep in his closet rather than in a bed. So if he sleeps in the closet and wants to sleep all night, fine. Like it's not a battle she's trying to pick with that bed. But when he gets up, they've tried bringing him into their bed to see if he'll co-sleep. That doesn't make any difference. They've tried having no extra milk or snack before bed. The OT suggested doing lots of crashing before bedtime. And mom feels like it helps him fall asleep, but he doesn't stay asleep. They do have a very consistent nighttime routine that both mom and dad participate in with him. They've tried picture communication and he's lost interest in using it. And he stopped using many gestures and signs to communicate. And they will place him, like when he has a behavior that isn't appropriate, they'll either place him on the couch or they have like a little entryway that they'll put him in there so she can just kind of block him from accessing little brother or toys or whatever the issue was, until he has calmed down enough and he'll use calm hands and feet. They try to talk to him about using nice hands and we can't hurt. He seems to really have a very good understanding of language. And when you talk to him, he seems to really understand, but it doesn't prevent him from doing it. Let's see. They have not tried using a sleep tent. And he does use the bathroom and have a stool. So that's not been an issue. Any other questions? That is a good question. I don't know that they have any dental issues. I don't remember Mom saying anything. Shelby, do you remember saying if they've gone to a dentist? I don't remember saying anything about a dental. And he has not been evaluated for autism. When we first evaluated him, we did the MCHAT and he scored medium risk. And so that's kind of been a question. And he has some skills that make me wonder if that couldn't be it. But then he has really nice social skills. He has really good eye contact. He's got sensory issues, but he doesn't do any of those skimming type things. So that it could be. And Mom has kind of questioned that, but she hasn't done any more like research or made any follow-up appointments to see if that truly is an appropriate diagnosis for him.
I feel like it's so like one week I'm like, oh yes, this is like autism, but then I'll go back and I'm like, no, maybe not. So it's kind of one of those situations where he's very borderline almost.
Can I interject a comment?
Yeah.
So I think that's the hard time is the kids that are higher functioning or social that way tend to go under the radar, but he sounds like a lot of the behaviors, the sleep, the feeding, all these things, you know, goes under that umbrella of neurodiversity of later on, I would suspect he'll probably get diagnosed with an ASD or an ADHD, unless there's some other trauma besides just moving. But it sounds very similar. My youngest daughter did not get diagnosed till age 7 just because she was way too social, made eye contact, and fit. But as she's gotten older and more is expected, more became apparent. So I always kind of like to make sure parents are prepared for that, and maybe we, you know, help them get an evaluation sooner rather than later, just because that's my biggest thing is kicking myself like, oh, I could have done it earlier. But for behaviors, have they tried any type of play therapy?
Besides what we provide going into the home, they haven't done any outside except for that OT and speech. So that would be it. So no, they have not tried any specific play therapy or any even specific ABA besides what I provide in the home, which is only for like an hour a week.
Have you guys asked about other trauma, like birth, pregnancy, all that kind of stuff?
No, nothing unusual. And really, like, moving was the biggest thing that's happened, and that was this summer. And it seemed to really help at first because then he did have more space. They were in a smaller home before. And once he had more space, he became a much more, I don't want to say a happier child, but like he made more facial expressions. Before, he was very one tone. There was very little smiling, very little frowning, just seemed very discontent. It was just very mute. Once he had more space, he all of a sudden had different facial expressions and would laugh and would giggle. And so we saw a new side of him. So we really thought, oh, you know, having more space, being able to meet some of those needs is great. And it has been great, but it's almost like he reversed in some ways, which is just interesting. I hadn't seen something like that before.
So Jesse and Shelby, I'm just going to ask you guys to clarify, what is the one thing that you would like our group to give you feedback on? Would it be some resources on how to try one new food a week? Would it be reducing aggressive behaviors? What would you like us to kind of give you some recommendations about?
I think for the sake of this, it would be some of that feeding. Because just having watched Little Brother, I mean, anger is a real thing, right, for all of us. So sometimes I wonder if he's still hungry or there's still something else that he needs, that if that isn't causing some type of a behavior and he doesn't know how to get that need met.
Okay.
So if some resources on how do we get him to be more interested in trying to do food a week.
Okay.
Mom is very willing to do whatever.
So we're going to then go into breakout groups right now, and that will be our big topic, is some feedback on how to focus on one new food a week. So if you guys will take that information and have that discussion, and we'll come back in about, it will be a short breakout session, so only about 10 minutes.
And those rooms are open, so you should see an invite to join.
So Brianna, Kelly, Corinne, Delaney, do you guys all see Brianna and Kelly? Okay, Brianna and Kelly, I'm just going to put you in the weight room. Oh man, they both could have talked forever today.
I know.